All the action packed in 180 minutes. Power Breakfast with Tessa Dooms. Weekdays 6 to 9 a.m.
The time is 8:17. You're on Power Breakfast this morning with Tessa Dooms. And as we've said, we will be tracking the G20. South Africa has the presidency this year of the G20, and there are a number of different initiatives, almost 2 or 3 a week around the G20. And this week we focus on women's financial inclusion and the care economy. One of the things that South Africa is definitely looking at is reducing inequality through this mission. So on the line with us, the Minister of Women, Youth and Persons with Disability, Sindisiwe Chikunga, just to give us a sense of what are we going to be doing with the Women Empowerment Working Group in order to address financial inclusion of women. Thank you so much, Minister, for joining us this morning. Welcome to Power Breakfast.
Good morning to yourself and to your listeners, and thank you for having us.
And so you'll be at the helm of this working group around women's empowerment. What is the cornerstone of the work that you'll be doing here and the expected outcomes of this working group?
Yes, indeed. We are in Chikunga this week, attending the third technical meeting on Women Empowerment Working Group. And as you have said, we identified as a country 3 priorities: 1, care economy, paid and unpaid, and then financial inclusion for women, and then fighting gender-based violence and femicide. At the first technical meeting, we had to sell these priorities to the G20 member states and invited guest countries, and they were accepted by them. And then the second one, we started then to delve deeper into each one of them, particularly the last one in Northwest. We're focusing on financial inclusion and to some extent gender-based violence and femicide. And this one now in Chikunga, Kruger National Park, we are looking at the care economy, but also starting to draft the declaration that must be adopted by the ministers in October, which then will be included in the leaders' declaration, the presidents and leaders of government declaration. And that's what they are busy doing in Chikunga now.
We know that the care economy is a big issue given just the large numbers of women around the world, not only in South Africa, who do care work that is undervalued, where they do not get fair reward for care work. Why have you decided as a ministry to focus on getting this on the global agenda, and how will it benefit, in your view, especially the women of South Africa?
First, I think it's important that it is recognized and valued. You have got the paid care work, for instance, if you think about health care, health professionals, for instance, if you think about education, social services, they provide the paid care work. However, because in the majority of those are women, sometimes it's not taken seriously. And we are saying that too must be taken seriously as the paid care work. But then you have got a lot of unpaid care work that is being provided probably by yourself because you are a woman from your family. You took care of your children, homework, etc. But you are also at work, evaluated the same way as your counterpart who didn't do anything, had time to prepare for the work, etc., etc. What we are saying is that should be recognized, that as women, we do more in our families as unpaid care work. But if you look at even that which is done in our families and say we hire a person, we pay them, and that which I do and
domestic
I'm not
workers,
paid for, it has to be valued. It has to be costed, and its contribution in the economy should be counted to say if you didn't have somebody at home, or if you had not done XYZ, you would not be at work because you would not have a dress to wear. And therefore, there's somebody who make it possible for you to be at work, for the president to be at work, for the minister to be at work, for the CEO to be at work. And that work must be must be recognized as the work that adds to the economy of the country. And that is what we're putting forward, and we definitely want to see a policy that is recognizing care work as the legacy project in South Africa, for instance.
And Minister, I have appreciation for that because, of course, when it comes to domestic work in South Africa, there's always this lamenting of having to pay domestic workers a fair wage. And people in South Africa, households that have domestic help and domestic workers with them, actually calling it help is actually the part of the problem, do seem to say, well, this is how much we can afford. And yet in other countries, domestic work is not as easy to come by as it is in South Africa. So I think the fact that we are putting it on the table is really important, because I think some of the practices are actually ones that we do quite poorly on, because there are other countries in the world where you can't afford it. You have to pay a fair wage for that domestic labor. You were talking about a charter that will be signed. How implementable will that charter be? What teeth will it be to get some fair wage for people like domestic workers?
I think there always must be a start. And I think what we're actually saying is very true, that we've actually said there must be a minimum wage for our people who are providing the care work. And that is important. And whether people are able to do it or not, but at least there's a start. And now what it means is that we've got to ensure that gets enforced, because they need to be paid. But that is the paid care work, which I believe should also be valued, because it's never valued. It's like if you are providing the care work, you are just part of the family, of the furniture and property of the house, and therefore you can be treated anyhow. We're saying it cannot be. That too should be considered as providing and contributing in the economy of the country. But there is the unpaid care work that is being provided by a girl child in the family who sometimes will not perform well at school, who may even drop out of school because she has to take care of the mother and not the brother, but the girl child. And that is never taken care of, and its implications and the unintended consequences should be put on the table, to say many of the girl children drop out of school because they've got to take care of the mother who is sick, of the father who is sick, of whoever. Yes.
And so there's a lot of work to be done when it comes to equalizing the gender pay gaps. And I think the care economy is a great place to start. Of course, this work is not going to be done quickly. There's going to be a lot of work that still needs to be done on the G20 in the lead up to November. So we'll be keeping an eye on that. But thank you so much. That's the Minister of Women, Youth and Persons with Disability, Sindisiwe Chikunga, just giving us an update on what the work that has been done around the G20 and advancing women's rights.